Hi everyone, welcome to researchmd.com. We got another presentation today. Today we're going to look at the difference between myasthenia gravis and lambert-eaton syndrome. People always get confused about these two syndrome, which is very similar, but there's like a strong points to differentiate from it. Again, my name is Pramil Cheriyath. I'm a program director, internal medicine residency program, transitional residency program. I also teach medical students, medical residents. I'm a director of research. I'm an assistant professor of medicine, two major medical schools. So let's get into our subject. So again, our topic today to differentiate between myasthenia gravis and lambert-eaton syndrome. What is the pathophysiology? In myasthenia gravis, we got autoantibodies to postsynaptic acetylcholine receptor. Okay, in the lambert-eaton syndrome, you got autoantibodies to presynaptic calcium channel, which decreases acetylcholine release. So you have two pictures right here. One is the myasthenia gravis, and the other one is the lambert-eaton syndrome on the right side. On the myasthenia gravis, you got the autoantibodies to the postsynaptic acetylcholine receptor, and so the acetylcholine will not be able to bind it, so it will not work. No muscle function will be available. On the next side, you got the lambert-eaton syndrome. Here, if you look at it, it's in the presynaptic region, is the calcium channel block, calcium channel, that's where the problem is, autoantibodies. So the release of acetylcholine is affected. Okay, so please make sure you know the difference. Autoantibodies to presynaptic acetylcholine receptor in myasthenia gravis, autoantibodies to in myasthenia gravis, autoantibodies to postsynaptic acetylcholine receptor. Okay, in the lambert-eaton syndrome, autoantibodies to presynaptic calcium channel, and that will decrease the acetylcholine release. What are the clinical symptoms and different? Okay, myasthenia gravis, you got ocular muscle weakness, ptosis and diplopia, respiratory muscle weakness, dyspnea, bulbar muscle weakness, dysphagia, difficulty chewing, spare reflexes, and worsen with the muscle use. Remember that, worsen with the exercise or worsen with the muscle use, myasthenia gravis. So what do we have in the lambert-eaton syndrome? You got proximal muscle weakness, autonomic dysfunction like dry mouth, constipation, impotence, and hyporeflexia, and improve with the exercise or improve with the muscle use. Remember that. Myasthenia gravis, worsen with the exercise. Lambert-Eaton syndrome, improve with exercise. So very striking different. Okay. In clinical association, myasthenia gravis, you'll find thymoma and thymic hyperplasia. In the myasthenia gravis, the treatment option is also removing the thymoma. In the lambert-eaton syndrome, 60 to 70% of the people always kind of associate with the small cell lung cancer. So if you have to think it's a lambert-eaton syndrome, link it with the lung cancer, which is small cell lung cancer. Okay, myasthenia gravis not associated with the lung cancer. Now, how do you diagnose it? In myasthenia gravis, you got acetylcholine receptor antibodies and MuSK antibodies, reparative nerve stimulation, and single fiber electromyography. Those are the main way you diagnose myasthenia gravis. In the lambert-eaton syndrome, you have voltage-gated calcium channel antibody assay. You can do striated muscle autoantibody to reflex titer and reparative nerve stimulation, and those are the tests you can do. Now, acetylcholine esterase inhibitor effect in myasthenia gravis, it reverses symptoms when you give pyridostigmine for treatment. Okay, in the lambert-eaton syndrome, you will have minimal effect when you give the acetylcholine esterase inhibitor effect. Now, treatment in myasthenia gravis, mainly pyridostigmine, the new treatment, Soliris. You got like IVIG in myasthenia crisis. Of course, thymectomy also need to be considered if there is thymoma. In the lambert-eaton syndrome, you got 3,4-diaminopyridine, 3,4-DAP. You got new treatment, Firdapse, and which is amifampridine, and of course, you also have IVIG. Thank you so much for watching. Please subscribe to our channel. Thank you.